my name is Dr. Peven, and as my beautiful fiance said, I'm a naturopathic doctor, and I just wanted to give you maybe a little bit more context about like who we are, what we do. We go to 4-year medical programs where we're trained to practice primary care, and in the states where we have licensure, not every single state, but we are allowed to practice primary care. In Washington, where I'm still licensed and where I still maintain a practice, I have prescription authority. I can practice medicine as defined by the law, and I moved here for Sarah, for our family. But I still have my practice in Seattle, and I do go back to see patients there, and I do telehealth with patients there. And I'm planning to start a practice here. And of course, I won't be able to do the same types of things here that I do in Washington. And that's been a very common story for my colleagues, is they come here often for family, they come to Florida, and they're kind of in a bind because we work very hard in order to learn this profession and to be able to offer medical services to our patients. And coming to Florida, we're either we're illegal, and we're skirting the law and talking to patients and caring for patients in a way that's technically not legal for us, or we have to tell patients that we can't do a huge part of what we're trained to do. And from my experience, patients actually don't care if we're not licensed. They're like, the patients that know about NDs, when they find us, they're like, okay, like I know about naturopathic medicine, like this is what I want from you. And we tell them that we can't do that, and they don't like that, they get upset. The other part of it, of course, is that we are a small profession, and I think a lot of people, especially after the last several years, are looking for alternatives, are looking for ways to not just treat disease, but to actually become healthy. And that is what we specialize in, is really getting people to be healthy, as well as, we're trained in a lot of the conventional techniques, we understand pharmacology, and so we can be that bridge where it's not either you go to your primary care doctor that you're really not always satisfied with, or you're, seeing someone who has no formal training. And yeah, I just appreciate being able to bring this to your attention.
Thank you.
Thank you.